Introduction to infertility. Infertility means having trouble getting pregnant even after trying for a year or more without using protection. It's a big issue for millions of people around the world and affect not just them, but also their families and communities. For guys, it often happens because of issue with releasing semen or having low sperm level or abnormal sperm shape and movement. For women, it can be because of problem with their ovaries, uterus, fallopian tube or hormones. The World Health Organization estimates that 1 in 6 people are affected by infertility. There is a similar trend in Malaysia with a drop in fertility rates from 4.9 children per woman of childbearing age in 1970 to 1.7 in 2021. Infertility is defined as not being able to conceive after 1 year of unprotected sexual intercourse. In women above 35, this duration is sometimes shortened to 6 months. Cause of varied, involving issue in either partner or both, and in some cases that the causes are difficult to identify.
So this is the current data for IVF.
There are many factors that lead to infertility problems. One of it is endometriosis. Endometriosis is a disease that occurs when tissue that resembles the lining of the uterus grows outside of it. It can damage the ovaries or fallopian tubes, cause inflammation, scar tissue, and fertility problem. Next is age. The fertility of women gradually decreases around the mid-30s, and it rapidly declines after age 37. Most typically have fewer and lower quality eggs. Meanwhile, males over 40 are less fertile than younger men. Next is sexually transmitted disease or STD. Untreated STDs can lead to infections that progress along the reproductive system, damaging, inflaming, or spreading to a woman's uterus, ovaries, and fallopian tubes, and it ultimately resulting in infertility. The last one is smoking. Smoking lowers sperm count and degrades sperm quality. Egg loss is accelerated by the toxins in cigarette smoke, and once an egg has died, it cannot be revived.
Introduction to IVF. Many treatments have been discovered due to solve these infertility problems, such as hormone injection to stimulate egg production, intrauterine insemination or we call IUI, and in-vitro fertilization IVF. Our team chosen treatment to do researching is IVF. Through this video, we will learn the procedure and things that related to this treatment. So this is the treatment and procedures involved in IVF. The first procedure is birth control pills and estrogen. Your healthcare provider may prescribe birth control pills or estrogen. This is used to stop the development of ovarian cysts and control the timing of your menstrual cycle. It allows your healthcare provider to control your treatment and maximize the number of mature eggs during the egg retrieval procedure. Some people are prescribed combination birth control pills, estrogen and progesterone, while others are given just estrogen. The second one is ovarian stimulation. Take injectable hormones medication to encourage the entire group of that cycle's egg to mature simultaneously and fully. Monitoring. Your ovaries respond to the medications is monitored by ultrasounds and blood hormone levels. Monitoring can occur daily or every few days over 2 weeks. Most stimulations last between 8 and 14 days. Trigger shot. When your eggs are ready for final maturation, determined by your ultrasound and hormone level, a trigger shot is given to finalize the maturation of your eggs in preparation for egg retrieval. You will be instructed to administer the triggered shot exactly 36 hours before your scheduled egg retrieval. Next, procedure for egg retrieval. Your healthcare provider uses an ultrasound to guide a thin needle into each of your ovaries through your vagina. The needle is connected to a suction device used to pull your eggs out of each follicle. Next, your eggs are placed in a dish containing a special solution. The dish is then put in an incubator in controlled environment. Egg retrieval is done 36 hours after your last hormone injection, which is the trigger shot. After the egg retrieval, the fertilization will happen. The afternoon after your egg retrieval procedure, the embryologist will try to fertilize all mature eggs using intracytoplasmic sperm injection or ICSI. This means that sperm will be injected into each mature egg. Immature eggs cannot have ICSI performed on them. On average, 70% of mature eggs will fertilize. For example, if 10 mature eggs are retrieved, about 7 will fertilize. If successful, the fertilized egg will become an embryo. Next, the embryo development. Over the next 5 to 6 days, the development of your embryos will be carefully monitored. Your embryo must overcome significant hurdles to become an embryo suitable for transfer to your uterus. On average, 50% of fertilized embryos progress to the blastocyst stage. This is the stage most suitable for transfer to your uterus. For example, if 7 eggs were fertilized, 3 or 4 of them might develop to the blastocyst stage. The remaining 50% typically fail to progress and are discarded. All embryos suitable for transfer will be frozen on day 5 or 6 of fertilization to be used for future embryo transfers. After the embryo development, we will transfer the embryo. A fresh embryo transfer means your embryo is inserted into your uterus between 3 and 7 days after the egg retrieval procedure. This embryo hasn't been frozen and is fresh. A frozen embryo transfer means that frozen embryos from a previous IVF cycle or donor eggs are thawed and inserted into your uterus. This is a more common practice for logistical reasons and because this method is more likely to result in a live birth. Frozen embryo transfers can occur years after egg retrieval and fertilization. The last procedure in IVF is pregnancy. Pregnancy occurs when the embryo implants itself into the lining of your uterus. Your healthcare provider will use a blood test to determine if you're pregnant approximately 9 to 14 days after embryo transfer. Then you will have your own baby.
What do we have to prepare for IVF? IVF consultation and uterine exam, a semen analysis, screening for sexually transmitted infection, ovarian reserve testing and blood and urine test, instruction on how to administer fertility medication, genetic carrier screening, signed consent form, and uterine cavity evaluation. Additional information. In Malaysia, the cost of fertility treatment through the in-vitro fertilization method varies according to the hospital, but the estimated price of the service is between RM7,000 to RM15,000 per cycle. An IVF pregnancy isn't automatically considered high risk. An IVF pregnancy will be considered high risk if there's a medical condition that makes the birthing parent high risk. For example, advanced maternal age, expecting multiples, or high blood pressure. Common side effects after embryo transfer are constipation, bloating, cramping, breast tenderness from high estrogen, and spotting.
There are many ways to increase the fertility. Firstly, you can have the healthy diet. Next, get enough sleep. That reduce the stress and exercise regularly. Also, you can have the health checkup, quit smoking, quit caffeine, and lastly, you can maintain health weight. The Quran verse that related to the infertility issue is in Surah Ash-Shura, verse 49 to 15. A'udzu billahi minasyaitonir rajim. Lillahi mulkus samawati wal ard, yakhluqu ma yasha, yahabu liman yasha'u inathan wa yahabu liman yasha'u az-zukur. أو يزوجهم ذكرانا وإناثا ويجعل من يشاء عقيما إنه عليم قدير. The Quran verse meaning, to God belongs the dominion of heaven and earth. He create what He will. He bestow female offspring upon whom He wills, and bestow male offspring upon whom He wills. Or He bestow both male and female, and He leaves children whom He wills. For He is all-knowable, all-powerful. Al-Azhar University or Jami'ah Al-Azhar's Fatwa Committee, which is the leading international authority for Muslims around the world, say that in 1918, Al-Azhar issued fatwa declaring that test tube baby, IVF and similar technologies are permissible as long as they do not involve any form of third-party donation of sperm, eggs, embryo or uterus. So the conclusion from the fatwa that we take from the Jami'ah and the Quran is most of the modern reproductive technologies are quite new. Although the Quran and Hadith do not specifically address any one process, scholars have developed the idea by interpreting these such guidelines.
To conclude, in vitro fertilization is a method used to help married couples who have difficulty in getting pregnant. It involves combining egg and sperm in lab dish. Once the egg is fertilized, it will implant it into uterus. In vitro fertilization is a complex process with its own set of challenges, but it has been a game changer for many married couples that are struggling with infertility by offering them a chance to have a child. Nevertheless, in vitro fertilization is not a guaranteed solution. Hence, it is essential to weigh the physical, emotional and financial aspects carefully before embarking on the IVF journey. As a Muslim also, we need to have faith in Allah for the risk that has been denied.